Depression after quitting meth is real, and it's more than just feeling a little down. It's your brain trying to recover from major chemical changes. In this video, we'll break down why depression happens after meth. Detox, 10 strategies to cope, warning signs. You may need rehab. Again, signs of severe depression, how rehab helps, and some quick FAQs before we wrap up with where to get help. Why depression happens. After meth detox is actually pretty straightforward. Meth gives your brain an artificial flood of dopamine. That's the chemical that makes you feel pleasure and motivation. When you stop using, your dopamine levels crash, and that's when the tough stuff hits. The sadness, the lack of energy, and losing interest in things you used to care about. This dip can stick around for weeks or even months, and it's one of the big reasons early recovery feels so hard. There's even a name for it: post-acute withdrawal syndrome, or PAWS. Let's look at 10 strategies to cope with post-meth depression, including things you can start using right now to feel better and protect your recovery. First off, seek dual diagnosis treatment for meth addiction and depression. Dual diagnosis treatment means addressing both the meth addiction and the depression at the same time. This integrated approach lowers your risk of relapse and strengthens your mental health. Second, attend therapy or counseling, individual or group. Therapy can help you unpack old wounds, change negative thought patterns, and build healthy coping skills. It's especially effective if you try approaches like CBT, trauma therapy, or join support groups where others share your struggles. Third, talk to a doctor about antidepressants. Meth changes your brain chemistry, and sometimes medication is needed to restore balance while your brain heals. Combined with therapy, this can speed up emotional recovery. Fourth, get consistent, quality sleep. Sleep is a huge factor in recovery. Sticking to a regular bedtime, winding down before sleep, and limiting screen time can help your brain reset and stabilize your mood. 5. Exercise to rebuild dopamine and confidence. Exercise is one of the best natural mood boosters. Even 20 minutes of walking, cycling, or swimming can raise dopamine levels, improve sleep, and boost energy. 6. Improve your nutrition and gut health. What you eat matters for recovery. High-fiber fruits, vegetables, whole grains, probiotics like yogurt or sauerkraut, and anti-inflammatory foods can help your gut and your mood. 7. Try mindfulness meditation. Mindfulness teaches you to focus on the present. Simple breathing or sensory exercises can reduce cravings and calm anxiety. 8. Get outside and into nature. Every day, nature is a natural healer. Sunlight helps regulate sleep, boost vitamin D, and lift mood, while outdoor time gives you a break from stress and technology. 9. Build a strong support system. Recovery is easier when you're not alone. Friends, family, and recovery groups can help you stay accountable and encouraged. And the 10th way you can help get over a meth detox is to explore supplements cautiously. Some supplements might help mood, but always check with your provider first before trying options like magnesium or folate. Let's cover a few warning signs that you may need meth rehab. Again, because barriers to recovery isn't just about using again. If you're reconnecting with old using friends, fantasizing about meth, isolating yourself, or considering meth to cope with stress, it's time to reach out for help. Keep an eye out for these signs of severe depression after meth use, because they mean you should get help immediately. These can include suicidal thoughts, having a plan, self-harm, or giving away personal items. Rehab helps with depression and addiction recovery by tackling both conditions at the same time, with therapy, medication, and holistic care like yoga or animal therapy. Here are a few frequently asked questions about meth recovery and depression and what people need to know. Can meth withdrawal cause depression? Yes, dopamine depletion after quitting can trigger it. How long does post-meth depression last? Weeks to months, depending on the person. What helps with meth withdrawal symptoms? Medication plus counseling often works best. Is depression in recovery normal? Common, yes, but treatable. How can I help someone quit meth safely? Approach with empathy. Avoid judgment and help them find professional care. Reach out today because recovery is possible and depression can get better. Use Detox.com to find the right detox facility because the right support can help you feel better and stay on track.